Phlebotomy technician full practice test. Question 1. Which additive is used to prevent the breakdown of glucose? Ammonia, sodium fluoride, blood alcohol, sodium heparin. Sodium fluoride is the additive in gray top tubes that inhibits glycolysis, preventing red blood cells from metabolizing glucose. This preservative is essential for accurate glucose and lactate testing, as it maintains glucose levels for up to 24 hours at room temperature. Question 2. A phlebotomy technician is preparing to obtain a blood specimen to determine a patient's sodium level. Which color tube should be used? Orange, green, black, blue. Green top tubes contain lithium or sodium heparin and are used for chemistry tests, including electrolyte panels such as sodium, potassium, and chloride. Heparin prevents clotting by inactivating thrombin, allowing plasma to be used for testing without waiting for clot formation. Question 3. Which site should be selected for capillary blood collection in an older adult patient? Heel of the foot, distal phalanges of either middle finger, wrist area near the pulse, palm of the arm. The distal phalanges, fleshy pads, of the middle or ring finger are the preferred sites for capillary puncture in adults. These fingers are less calloused and have adequate blood flow, while the heel is reserved for infants and the wrist/palm contain nerves and are too sensitive. Question 4. Which color signifies a health hazard in the NFPA marking system? Black, blue, orange, yellow. In the NFPA 704 diamond, blue indicates health hazard, red indicates flammability, yellow indicates instability/reactivity, and white indicates special hazards. The hazard level is rated from 0, minimal, to 4, severe. Health hazards include toxicity, corrosivity, and other risks to human health. Question 5. Which identifier follows a specimen as long as it remains in the laboratory? Patient number, health record number, medical record number, accession number. The accession number is a unique identifier assigned to each specimen upon arrival at the laboratory. It tracks the specimen throughout all laboratory processes, including testing, reporting, and storage, ensuring proper identification and traceability. Question 6. What should the technician do for a patient who fainted during her last blood draw? Ask the patient to lay down for the procedure. Encourage the patient to sit up straight. Perform the draw while patient is standing. Tell the patient to breathe deeply and relax. Patients with a history of fainting, syncope, should be drawn in a supine, lying down, position to prevent injury from falling. The patient should remain lying down for 10 to 15 minutes after the draw, and the phlebotomist should monitor for signs of vasovagal reaction. Question 7. Which test requires chain of custody guidelines? Potassium, blood alcohol, glucose, prothrombin time. Chain of custody is required for legally sensitive specimens such as blood alcohol, drug screenings, forensic studies, and DNA/paternity testing. This documentation tracks every person who handles the specimen from collection to analysis, ensuring integrity and admissibility in legal proceedings. Question 8. What should the technician do if a patient ate breakfast before a glucose tolerance test? Ask the patient when she last ate. Leave the room to find the patient's chart. Draw the blood sample immediately. Check the patient's vital signs. The technician should first ask the patient when she last ate or drank to determine if the fasting requirement was violated. If the patient ate within the fasting window, the test should be rescheduled because food intake will elevate glucose levels and invalidate GTT results. Question 9. What should the technician do if the collection bag only fills halfway and the vein collapses during blood donation? Use a larger needle to draw more blood. Massage the vein to encourage filling. Use a new collection bag to draw a new unit of blood. Wait for the vein to refill before proceeding. If a blood donation bag only partially fills and the vein collapses, a new collection bag must be used because the anticoagulant to blood ratio would be incorrect. The partially filled bag should be discarded, and the phlebotomist may attempt a new venipuncture at a different site if the donor is willing. Question 10. What is the total blood volume of an infant who weighs 3.3 kilograms? 240 to 330 milliliters. 100 to 150 milliliters. 150 to 200 milliliters. 400 to 500 milliliters. Total blood volume in infants is approximately 80 to 100 milliliters per kg of body weight. For a 3.3 kilograms infant, 3.3 kilograms times 80 to 100 ml/kg equals 264 to 330 milliliters, rounded to 240 to 330 milliliters. This calculation is critical for determining maximum allowable draw volumes to prevent iatrogenic anemia. Question 11. Which procedure requires chain of custody guidelines? Dawn level testing. Paternity testing. Rolling up his shirt sleeve. HCG testing. Chain of custody is required for paternity, DNA testing, drug screenings, blood alcohol tests, and forensic studies. This documentation ensures specimen integrity and legal validity, as paternity results may be used in court proceedings for child support, custody, or immigration purposes. Question 12. What is the first action when performing a finger stick? Confirm the identity of the patient. Prepare the equipment for the finger stick. Clean the finger with alcohol immediately. Ask the patient about their medical history. Proper patient identification using two unique identifiers is the first and most critical step in any blood collection procedure. This prevents specimen mix-ups, misdiagnosis, and potential medical errors. Identification should be completed before preparing equipment or cleansing the site. Question 13. What is the minimum rinse time for a chemical splash to the forearm after removing contaminated clothing? 20 minutes. 10 minutes. 15 minutes. 45 minutes. The ANSI standard recommends flushing chemical splashes with copious water for at least 15 minutes to dilute and remove the chemical. Immediate irrigation is critical to minimize tissue damage, and the affected area should be rinsed even before removing contaminated clothing if possible. Question 14. Which tube should be filled first in the order of draw for venipuncture? Gray top. Yellow top. Purple top. Green top. Yellow top tubes, blood culture or SPS, are drawn first in the order of draw to prevent contamination from additives in other tubes. Blood cultures require the most sterile technique, and drawing them first minimizes the risk of introducing contaminants from subsequent tube additives or needle surfaces. Question 15. What is the correct action when using an evacuated needle holder and blood collection tubes? Shake the tube vigorously before inserting it. Push the first collection tube gently into the holder. Pull the tube out forcefully to ensure it is secure. Insert the tube without any holder for better access. The first tube should be gently pushed into the evacuated tube holder until the needle punctures the stopper and blood begins to flow. The tube should be held securely but not forced, as excessive force can cause the needle to dislodge or the tube to break. Shaking tubes before filling is unnecessary and may cause hemolysis. Question 16. When should specimens be labeled? After they have been transported. At the time of collection in the presence of the patient. Based on memory after the collection. Using generic labels without patient details. Specimens must be labeled immediately after collection while still in the patient's presence to ensure accurate identification. The label should include the patient's full name, date of birth, collection date and time, and phlebotomist's initials. Labeling away from the patient risks misidentification and specimen rejection. Question 17. What should the technician do if the patient's last name on the requisition differs from their identification? Contact the ordering provider to correct the requisition. Ask the patient for their social security number. Proceed with the blood draw regardless. Ignore the discrepancy and continue. Any discrepancy between the requisition and patient identification must be resolved before proceeding. Contact the ordering provider to correct the requisition form. Drawing blood without correct identification could lead to misdiagnosis, wrong treatment, or transfusion errors. Question 18. Which vaccine must employers offer to phlebotomists at no cost under OSHA standards? Hepatitis E, Hepatitis B, Hepatitis C, Hepatitis D. OSHA's bloodborne pathogen standard requires employers to offer the Hepatitis B vaccine free of charge to all employees with occupational exposure to blood or other potentially infectious materials. The vaccine must be offered within 10 days of initial assignment, and employees may decline but must sign a declination form. Question 19. Why should the total volume of blood drawn from a patient be documented? To calculate the patient's weight accurately. To determine if the patient is at risk for iatrogenic anemia. To assess the patient's hydration level. To record the patient's blood type. Documenting total blood draw volume helps identify patients at risk for iatrogenic, hospital-acquired, anemia, particularly in hospitalized patients requiring frequent testing. Excessive blood collection can contribute to anemia, especially in neonates, pediatric patients, and those with pre-existing low blood volume. Question 20. What information must a laboratory requisition form include? Laboratory CLIA number. Specimen identification code. Patient's organ donor status. Patient's previous medications. A requisition form must include a specimen identification code, accession number, to track the specimen throughout laboratory processing. Other required information includes patient identifiers, ordering provider, tests requested, collection date and time, and any special handling instructions.